Talk to me, Chow.
Julia Dutra, 34, pregnant, power 1, gravida 0, fainted in a yoga class. An AFib at 150, BP 90/60.
Hi, Julia. I'm Dr. Manning. This is Dr. Halstead. I told them I don't want to be here.
Hopefully this won't take long. On my count. 1, 2, 3.
Julie, are you okay?
I'm fine. Just call Mira.
Our midwife. I think Julie would be more comfortable at home with her.
Sir, your wife's in a dangerous arrhythmia. We can't let her go until we get it under control.
Do you have any history of heart disease?
No, I don't eat red meat, and I keep a high antioxidant profile to minimize inflammation.
Okay, good. Let's get an EKG, cardiac lab, CBC, CMP, coags in a UA, and let's start 5 of Rapamil IV, okay?
No medications.
This one's safe for pregnancy.
If we don't control your arrhythmia, it could put the baby in danger.
Is that true?
Scott.
What? We don't want anything bad to happen?
Okay, fine, but then we're leaving.
Thank you. All right, let me ask you a few more questions.
Wait, what are you doing?
Just a quick fetal ultrasound.
No, get that thing off me.
Acoustic radiation impairs neurodevelopment.
That's not actually true. Note that the fetus measures normal size and weight for 5 months.
Wait, what did you say?
That this looks like a normal 5-month pregnancy.
Measure it again.
I'm sure of the numbers.
Well, you're wrong. Measure it again.
See? Totally normal for 5 months.
Except I'm not 5 months pregnant. I'm 8.
Julie's labs.
Anemia, vitamin deficiencies, all the signs of early kidney failure.
And no family history of troubled pregnancies or genetic conditions.
Maybe a malabsorption syndrome?
Miss Dutra, have you ever had any gastrointestinal issues, Crohn's, ulcerative colitis?
I used to have leaky gut. At first, we thought it was just lactose, but of course, it was more complicated than that.
Okay.
I see. And were you seeing someone for this?
My nutritionist, she got me off lecithin and phytic acid. It helped some, but then once I got pregnant, I had to give up all GMOs and anything that wasn't locally sourced, too.
So what do you eat?
Certain strains of Swiss chard, broccoli. Sometimes I'll have a cup of adzuki beans.
But she supplements a lot. Selenium, coenzyme Q.
You eat 3 meals a day? More? Less?
I do portion control to manage the baby's glucose. 700 to 800 calories a day. Why?
We suspect the difficulties with this pregnancy are being caused by your diet.
That can't be. I only eat organic.
But you're not getting enough protein or iron.
And we're seeing the effects it's having on your baby. We need to start aggressive IV nutrition to help it grow as much as possible before you deliver. If we admit you to obstetrics now, I understand that you don't want to be here, but at this point,
you're not giving me IV food.
Your baby is severely malnourished.
No, my baby is getting healthy farm-to-table nutrients. You're not going to pump him full of toxins and chemicals.
Miss Dutra.
I said no.
Your arrhythmia hasn't resolved yet. We'll be back in a minute to check on you.
She's starving that baby to death.
We need to talk to Goodwin. Yeah, your heart isn't responding to the meds. If things keep going in this direction, we may need to consider an emergency C-section to take the extra load off your heart.
Drug me up and cut me open? No way.
That's not what we want either, but we do need to protect you and your baby. That's why in the meantime, if you allow us to give you some IV nutrition—
No way. Those bags off-gas PPAs? Look, you don't get it. This baby is being formed from every single molecule that enters my body. It is my job to keep it absolutely pure. That is how I'm protecting it.
They understand
No,
that.
they don't.
Excuse us. Please tell me you have some good news.
I'm afraid not. The committee ruled that we can't intervene against her wishes, not even for the sake of the baby.
So that's it. We just have to watch as she lets the baby die.
If that's what she chooses to do.
But that's not what she wants. She wants to help her baby. She's just confused about how to do it.
I'm sorry. Our hands are tied.
Mr. Dutra? Hi. I need you to talk to your wife.
She won't listen to me.
But you do understand this has gotten out of hand.
Of course I do. I mean, all she thinks about is how uric acid and compromised soil are infecting everything we eat. What do I say to that?
How did you handle it in the past?
Wasn't this bad before. I mean, she's always struggled with anxiety and control issues. Yeah, but when she got pregnant, it's like she turned the dial straight to 11. Nothing's pure enough anymore. Everything looks like baby poison.
But there has to be something you can say to get her to let us help.
I am so scared my wife and my baby are gonna die. Can't you do something?
What the hell are you trying to do to me?
Please, Miss Jujar, let me
I told you no food.
One second.
What's going
I need
on?
you to calm down, okay?
She
Please.
put this in my IV behind my back.
Miss Jujar, wait.
Glucose, amino acids. You did this?
First place.
Miss Jujar, Miss Jujar, please.
Dutra, just relax.
Miss Jujar, we need to get you back into bed.
Get her away from me. Get her away from me.
I need some help here. All right, easy. Relax, I have her. Just get her back up.
You're very lucky her husband convinced her not to pursue action against you or the hospital.
Miss Goodwin, I'm sorry.
I expect better from you, Dr. Manning.
Nat, wait.
I'm sorry.
I'm really not interested.
I understand. If you didn't trust us before, you certainly have no reason to trust us now.
Then we finally agree on something.
Julie, fearing for your baby's safety is the most natural thing in the world. When I was pregnant, I lost my husband. I was afraid of a lot of things. And then one day, after I had my son, I was up in a high-rise building on the balcony and suddenly had this vivid image of myself falling over the railing. And my first thought was what would happen to my son if I wasn't here for him. And the craziest part is my favorite thing in the world had always been Ferris wheels and roller coasters and being up in the air. But from that day on, I had this totally irrational fear of heights. It is really scary being solely responsible for that tiny, defenseless person inside of you. But you are letting your fear win. And it's gonna end badly. Anyway, I am sorry.
Dr. Halstead.
Her heart rate's too high and her pressure's dropping.
Baby's heart rate's down to 90.
It just hurts.
Your arrhythmia is escalating out of control. Push 10 milligrams of diltiazem and upper O2 to 6 liters.
We need to do a C-section. We have to get the baby out.
No.
Julie, I know you don't trust me, but your baby is in real danger.
84?
Julie, let them do it.
I can't.
Julie, if you don't let us do this, your baby is going to die.
You can't do it.
Thank you. Call Abby and tell him we're coming up for a crash C-section now.
You heard her, let's move.
How are you feeling?
I'm okay. What are they putting in him?
Proteins, carbohydrates, fats. He needs them to grow.